But it is something more serious because it's something that a lot of parents may face, or grandparents. As a matter of fact, I was just talking to somebody the other day who's having some problems with their child because of behavioral issues. And if you notice that your child is acting out, a lot of people might not know where to turn, what to do, who to call, especially if you're having a hard time making ends meet. If you need that kind of assistance, it can be costly.
That's right, but CNS Healthcare has a potential solution for everyone. Susan Angel of CNS Healthcare is here to talk today about all of it. Hello, Susan. Thank you for joining us today. Let's just ask you the question, why do some kids act out, not listen, and maybe get into mischief?
Well, aside from just being normal kids, I mean, that's the first thing. And if it's something that's just occurring infrequently, well, then you probably just have a normal kid on your hand doing what they do. But when you
Testing the limits.
Yeah, I mean, but if it's something that's persistent, it's frequent, it's getting them in trouble at school with their peers or at home, then that's something you may need to look into, because sometimes there's stressors in the house. There can be issues with depression or ADHD that are affecting them.
Yeah, so if you think that it might be ADHD or depression, what are the signs and warning signs and symptoms you need to be on the lookout for?
Well, both children, little kids, 6 to 11, preteens, teens, can each have their own set of symptoms, but typically those kids will have problems with their schoolwork. They may be having irritability, difficult to get along with. They're withdrawing from friends and family. They may be restless, sleep issues, a host of problems.
So do the signs of ADHD or depression, do they change depending on the age of the child? Like, what are the warning signs at different ages, I guess?
Well, when you think of a kid with ADHD, you think of your little kid that's bouncing off the wall, can't sit still, is kind of into everything. And that's what you may see with a kid who's got hyperactivity. But when you move into the teenage years, you start seeing some different set of symptoms. There may be more defiance, there may be more getting in trouble, acting out behaviors, even substance abuse, alcoholism, and risky behaviors.
So what can CNS do then if a parent finds themselves in that situation?
Well, we offer assessments. We have counselors, nursing staff on hand where the parent can bring their child in for a free assessment. And during the free assessment, we can look at the stressors, look at what's going on, see what kind of symptoms they have, and if they're meeting diagnostic criteria for a certain issue. And if we find that there's something that's going on with the kid that we can help out with, we can talk about some of our clinical studies that we have going on.
Right, so you've got some free trials and things like that that folks can participate in. How could a parent benefit from maybe one of those?
Well, what's great about the clinical studies we have going on for our children and adolescents is that these are medications that are currently prescribed on the market. So there's things that are already out there that we're familiar with, so it's nothing scary. So these medications oftentimes are approved for adults or approved for different indications. We're looking at them specifically for kids and see if they can benefit them in both their mood and their behaviors and other things.
So walk me through the process. If you want to come into CNS, do you need to make an appointment? Should you expect to pay anything? I mean, how does the whole operation work?
Right, there's different ways you can make an appointment. Number one, you can give us a call and our staff there can set you up with an appointment to come in, or you can make an appointment through the website. All these appointments are at no cost. There's no health insurance required at all. And if your child were to be enrolled in a study, you actually have the opportunity to earn a stipend. So you'll get, laboratory testing, psychiatric evaluations, physical examinations, etc. A real thorough workup for no cost.
And what if you're not sure? I mean, what if you're watching and you think, oh, my kid has some of these behaviors. I can't make I can't differentiate between whether it's just normal kid-like behavior or something that I should seek some help for. What would you say?
I'd still, have them come on in and meet with our counselor there, and they can certainly point you in the right direction. If a clinical study is something that's great for you, then fine. If you need a therapist or a counselor, we've got some resources that we can refer folks to. So, it's no harm just to bring them on in.
Well, Susan,
Great.
Thank you so much.
Thank
We
you.
appreciate you being here and giving us all of your insight and all of this. And we, of course, want to thank CNS Healthcare for sponsoring this segment.
Yeah, if you want to find out more or if any of their trials may be right for you or your family, you can call 904-281-5757 and make an appointment for a free 30-minute evaluation session. You can also log on to their website for more information at cnshealthcare.com. And remember, all of the services are free, no referral or insurance is needed.